everyone, I made it to day 5. But this video is basically gonna be on FAQs. I feel like I've been getting so many questions. I feel like I keep not repeating myself, like I'm mad about it. But I just want to let everybody know, so if they want to ask that question, I'm gonna keep answering. Okay, so the question is, people keep asking me how much was my surgery. My surgery was $7,220. How was your recovery? So since I'm only on day 5, I'm gonna say my worst night was night 1, and it wasn't because of pain or anything like that, because I didn't feel it. But it was more of I'm not used to sleeping on my back. So it's like I didn't go to sleep. I maybe sleep for 2 hours on the first night, and I think it was only because of uncomfortable, because me sitting leaning up wasn't just not. It's not rocking with me. When did you stop taking your medicine? I personally stopped taking my medicine on day 2. I took it at like 5:15 a.m. on day 2, but for the rest of the day, I did not take it at all. I haven't felt any pains, nothing like that, so I'm happy, but I feel like I had to go on Narco. In my previous video, I said I wasn't going to do Narco, but they said I have to for the surgery because they don't want me to feel anything. That's why I have this little patch, because I was saying my family, they do get they do feel really nauseous when they take it, so thank God I had this, but I didn't really want to take it because of the side effects I've seen. Now when I say side effects, I noticed that they were saying that when you take Narco, it stops your bowel movement, and I read that after, and I'm gonna insert a clip right here. Mama, why do I look 4 months pregnant in less than 4 hours? I promise you, I went on with my day, and then I was laying down, but I was leaning up, so I'm maybe it's a little pudge, when you laying down, it's a little something, So when I got up and went to the bathroom, I looked in the mirror and I was like, what? And so I looked like that, oh no. So that was one of the reasons why I got off that Narco. Right now, it's not as bad. It went lower, but compared to the pictures that I put in there, it's bad. Hopefully it goes down. I stopped taking it. Your doctor is supposed to prescribe you with some medicine to help you poop, because the Narcos do stop your bowel movement, and so that's why you get bloated, and I actually feel like I bloated. Another thing I've seen that a lot of side effects from the Narco, a little bit more of the antibiotics too, is that the antibiotics basically get rid of all the bad cells and the good cells. It just cleanses everything. For females, I feel like it hits the most. You can develop a bad yeast infection from it, and the reason why you get it is because it cleans out all the white bloods, all that. It cleans out all that, and it leaves you with nothing in your pH balance. So all the nasty, I think, go up in there and attack you, and you don't want that. I would ask your doctor to subscribe you with some fluconazole. I'm probably saying it so wrong, but I'll put it in the description below, or medicines that you want to use for it before you take your antibiotics, because I've seen what has happened to other people, and it's not not for me. So thank God I didn't feel any pain, and I didn't have to take those Narcos. Moving on to the next question. When was this through my insurance? No, because if it was through my insurance when I was back in 2014, I would have got it there. Who was my doctor? Now his name is Oscar Ho. He works for Kaiser Permanente and Stanford Hospital. He specializes in breast reconstruction, so when people have breast cancer, he practices on lifts, of course, and also implants. Am I gonna put anything on my scars? Yes. No, these gotta go. But of course, scars don't always go right when it happens. So basically, what I got is Mederma, coconut oil, and I also got it's called cocoa butter. It's a certain one. I'll put all that information in the description below to see which one works for you best. I haven't put any on is because my doctor told me. I don't know what anybody else's doctor told them, but he told me not to put anything on them until they heal more, because you don't want to get that stuff in there. You don't know how your body's gonna react to it. And I have eczema, and it's basically dry skin. Anything irritates my skin, like foundation. A lot of people always ask me what foundation to use. I don't use foundation. What I do is put a little bit concealer, so I look like I'm up and I'm ready to go. But yeah, so I haven't put them on yet. I think I can put them on in about a week. But those are the 3 I bought. Worst part of this procedure. I learned there's the first one. And the second thing is, yo, my boobs itch so mother bad. Okay? Like, I have tattoos down my rib cage, on my back, on my side. That has a little itch. The itch from healing, it's a whole nother story. Like, I be going like this, and people was talking to me. I don't even care anymore, because if they knew how this felt, they wouldn't even question me, because I feel like they'll be like, that's on, like, you know, yeah. So that them two, that little itch and going under, I guess was like the worst parts for me. Did I throw up from all the meds? No, and I think it was because of this patch. It's so weird. This little band-aid looking thing did justice. When was I able to shower? I showered 2 days after my surgery. My mom helped me. I didn't shower with this on. I got to take it off. But all I did was, like, I looked probably tired, but I was like, and then I just got water on it. And then after I got out the shower, I like pat dried. I took another shower this morning, August. That went okay, but yeah, I lose sensitivity in my nipples. I personally haven't really tried to feel them, because even if I wash my hands, I'm very nervous that I don't want to like touch it, and then you know, there might be some type of something on my hands or in my nails. You just never know. But when I go like this, I feel it more on this side, but this side not really. But I have like two different wraps on, so it's kind of hard to get there. Have I seen my boobs? Yeah, I have actually. I seen them on day 2. It was I was like, what's going on? She was looking at me. She's like, Dr. Ho did so good. I was just looking at him. I was like, yeah, but I understand why, because it's like the next day. What made me like feel that way was like, what do you mean they look bad? Is because my nipples, like, because they made it smaller, and then they stitch it back on. I don't know how all that worked, but it just was like, okay, yeah. So as today, they look way better. They're so cute and small. I still use my old bras. I don't know. I can't try them on because majority of my bras have wire in it. You're not supposed to wear wire for about 4 to 6 weeks after surgery, because they don't want it to rub against the incisions and the incisions open up, and that's a whole other story. So I will update you guys on that when I can put on a bra. But it might, I think it might fit. I don't know. It's my next check-in. My next check-in is Wednesday, June 13th, and that's when like they examine everything, because that's what, a week from surgery. And they just see like if everything's good, and I pray to God I get this bra, because doing this wrap, my boyfriend did it this morning. He was just so confused, but he did it. But like, it's like you gotta keep wrapping it. It can come like, you know, there's like, I don't know. I just feel like I just want to put on a bra. I don't want to have to worry about anything else. I don't want people to help me, because you're not supposed to lift your arms past your elbows are not supposed to stay on your side. For sure, I might have it, but I'm trying not to do it because, yeah. Speaking of that, a fun fact, because I feel like I was getting comfortable. So I made my bed, and I got this sheet, and I don't know why I forgot that I had surgery, but I got, you know when you get your blanket and you yank it and like it spreads out? Boy, when I tell you I heard something pop and hurt at the same time, what's that? Okay, yeah, don't do that. Yeah, I have like a little bit of blood came out of it, but it wasn't bad. Closed, I guess, from all these bandages. So we're good. Can you return to work? To be honest with you, my job's hella cool. I have unlimited paid time off. I originally asked for time off from the 6th of June to the 18th of June. I could go back this week, but I don't really feel comfortable driving right now because I haven't drove yet and I don't know how it's gonna feel. So I might just, my manager's like, you can work from home that week after, like, you know, your time off is off. She's freaking amazing. So yeah. What's different from the first day to today? I feel like I have so much, like, I have like more strength. I could do more. The first day after, my boyfriend had to brush my teeth, and bless his soul, child, he had my head bent like this because he's 6'5". He had my head bent like this. He was like open, and I had like heat. You know that little back part, that little bone? I felt like the tooth was kept hitting, and I was so loaded that I couldn't even say, babe, I'm doing. Finally, he moved away from that position, but God, there's another side. He kind of did it, and I kind of just looked at him. And then after, he just smiled and I'm like, no. And so, but yeah, he tried. He tried. He was like, I've never taken care of anybody before. And I was like, yeah, I see. Okay. You happy you did it. I feel so blessed and fortunate to have done this. And I'm blessed that God gave me this opportunity to do this. I feel like if don't let society make you feel any less because you're doing a surgery like this. I was a big girl. I was about 210. My ending weight was 129, but I gained a couple pounds since then, so I'm like 132, 135. I always misses up. But things change in your body, so don't let anybody like make you feel like, aren't you too young to do that? Your boobs shouldn't be like that. Have I went to clothes shopping? Girl, did I? I went to clothes shopping before I even got surgery. Forever 21 was having a bomb ass sale on them little one pieces. Let them know. I had like, see, I'm getting excited. I'm all sitting up. Let them know. So I got like 7 bodysuits. These for surely have one shopping. Got me little camos. I got a little bra. Like, you know. When can you go back to the gym? I never really went to the gym before the exercise. I don't really like gyms. Sometimes I'm lazy as fuck. But yeah, no, I don't know when the next time I'll be able to go to the gym. But if I did go to the gym, I think they said you have to wait like 6 weeks because you just want to make sure the incisions are like, you know, like they might look healed, but you never know. You can pull something and that will be really bad. What was your bra size before? I was 34, sometimes 36 double D. I feel like I would have rather been a D, but I felt like since I had extra skin, I wanted to make sure it all fit in there. How does your boyfriend feel about you getting it? To be honest with you, he's so supportive. And it's like, I wouldn't say I wouldn't expect it from him, but my boyfriend's fine as hell, like, you know. And I feel like it meant a lot that he didn't just like me for, you know, my outer appearance, like he liked me like within me. So when I actually opened up and showed him, and this was like 6 months into our relationship, he still loved me, and he was just like, I don't care if you get it or not. So I feel like he's been very supportive. He's in my room now playing dumbass Fortnite probably. Yeah, I despise that game, and I bet you hella females that they know their boyfriend plays Fortnite. You're nobody. So yeah, I think he's very supportive, and I love him so much. Did he help you recover? Yeah, like I said, the little toothbrush. That was day 1. I give him that. But today, he helped me put my wrappings on. And like, since you're not fully healed and he has like a horrible stomach when it comes to like stuff like that, I took it like a champ. Did you stay in the hospital after? No, I went home that same day. I stayed, my surgery was 3 hours. Stayed in recovery for about 45 minutes and I went home. I don't think really this surgery, well, I can say in California, they don't, usually you don't stay overnight because I feel like it's not that extreme. If you're a person who usually has complications after surgeries, maybe they will, but for me, last surgery I got was when I was 5 or 6. I had an outie in my belly button. It was a hernia. Cut it out. No, went home, no complications. So I think that's the reason why I didn't have to. But if I didn't get all your questions, please let me know, and hopefully I can answer them in the next video. I want to thank everybody who's been supporting me, and I hope this brings so much strength to other females who want to get this done. Thank you so much for watching. If you have social media, you can follow me on Instagram, Twitter. I don't really use Snapchat, but I'll put those in the link below. And yeah, I'm excited, guys. I'll keep you guys updated. Maybe a 2-week video update. So just let me know.